Common conditions of the circulatory system. Problems in the circulatory system will affect all systems in the body. It's important that the home health aide recognizes what a problem with the circulatory system looks like. Illnesses and disabilities can result from anything that slows down the blood flow through the closed loop system. Some of the symptoms that you should be monitoring are a fast or a slow heart rate, flushed skin, cold or clammy skin, feeling very weak and fatigued, low energy, changes in the ability to do activities that they normally could do, swelling of the feet, ankles, hands, fingers, and toes, pale or bluish lips, chest pain, sudden weight gain, shortness of breath, and severe headaches. There are many conditions in the circulatory system, but the most common condition you'll see as a home health aide are hypertension, angina, heart attack, congestive heart failure, and peripheral vascular disease. Hypertension is also known as high blood pressure. In the body, there are thousands of miles of blood vessels, including arteries, veins, and capillaries. Large arteries leave the heart, but as they travel through the body, they become smaller and smaller so that the blood components can reach their destinations. After the blood leaves the capillaries and enters the venous system, the veins go from tiny venules to larger veins, leading back to the heart. Blood flows through the capillaries, so important gaseous, nutrients, and waste products can exchange. Damaged capillary systems prevent nutrients and waste from exchanging. In a normal system, the blood vessels are very elastic and can stretch or shrink to deal with different outputs from the heart, like a faster heart rate from exercise or larger blood volume. For example, if the heart beats faster, more blood will be pumped through the system faster, which would cause the pressure in the system to go up. But if those blood vessels dilate or open, that allows the blood to move faster through the system, keeping the blood pressure at a normal level. If something impairs the vessel's ability to expand or contract, then the pressure in the whole system will be affected. Conditions like atherosclerosis, or the hardening of the arteries, cause arteries to become stiff, and the blood vessels are no longer able to respond to changes in outputs from the heart. What causes hypertension? Any condition that affects the blood vessel's ability to dilate and contract can cause hypertension. The one I just mentioned, atherosclerosis, or the hardening of the arteries, is one. Kidney disease, pregnancy, medications, and tumors in the adrenal glands. Why is hypertension harmful? Increased pressure within the blood vessels can cause unhealthy vessels to rupture or break, causing the person to bleed into important organs, such as the brain, the kidney, or the eyes. Hypertension can lead to strokes, heart attacks, kidney disease, or blindness. Now, how is hypertension treated? Often your patients may take something called a diuretic medication, and this will make your client urinate or pee more frequently to make sure that there's less blood volume, which can lower the pressure. Sometimes they will be on prescribed exercise programs that you may need to help them complete. Often they'll be on a special diet, particularly low sodium or salt, to lower the amount of water in the blood. And of course, reducing stress, anything that will stop the heart rate from rising too high. How can home health aides help? You can help by taking the client's blood pressure and pulse on a regular schedule. This could be once a week or once a month. Monitor the client for any symptoms. Support the client to continue special diets or exercise programs. Help them reduce stress. And remind the client to take that diuretic medication. A lot of clients don't like to take it because it means they have to use the bathroom more. But it's very important that they take it and they take it at the same time. The heart has its own blood supply, much like any other organ in the body. When the coronary arteries, or the arteries that supply blood to the heart muscle, are damaged or blocked, this is called coronary artery disease. This disease reduces the amount of blood nourishing the heart muscle. Angina is when blood flow to the heart is temporarily blocked, usually due to stress or exercise. If there's impaired circulation or narrowing of the coronary arteries, any stress put on the heart can cause a temporary blockage. Have you ever lost feeling in your foot from sitting too long? This is essentially what angina is, but in the heart. Symptoms of angina are chest pain, chest pressure, discomfort, and sometimes the pain will go down the left arm or up into the jaw or the neck. This pain usually happens after stress, a heavy meal, or exercise. Angina feels a lot like a heart attack, but it goes away with rest or with medication, while a heart attack won't go away. The main treatment for angina is something called nitroglycerin. Usually it comes in the form of a spray or a tablet that's taken under the tongue. This medication works by causing the blood vessels to dilate or open, helping the return of blood flow to the heart. But when those blood vessels open, it can also cause the blood pressure to go down and can make the client feel dizzy. Sometimes nitroglycerin is used as a patch that gives a constant dose of nitroglycerin while the client is wearing it. Generally, it's worn during the day when the client is performing activities, so it would be applied in the morning and removed at night. If your client has angina pain, what should you do? The first thing to do is encourage them to rest. Bring them their nitroglycerin so they can give it to themselves. If your client wears nitroglycerin patches, do not remove the patch unless directed to by the nurse or doctor. If the patch falls off in the shower, call your supervisor for directions. Help the client avoid heavy meals, overeating, intense exercise, and exposure to extreme cold, heat, or humid weather. A heart attack is when the blood supply to the heart via the coronary arteries is blocked for a long enough period of time that the cells and the tissues die. This could be a large or a small injury area, and certain areas of the heart could be more permanently damaged. If your client suddenly experiences symptoms of a heart attack, it is a medical emergency and you must call 911 immediately. Prompt treatment can quickly restore blood flow to the heart and prevent permanent damage or death. Symptoms of a heart attack are chest pain, which may radiate down the left arm or up into the neck, shortness of breath, feeling like they have indigestion or they need to belch, nausea or vomiting, intense sweating, cold, clammy skin, feeling dizzy, and a sense of impending doom. After having a heart attack, the client will usually go through cardiac rehabilitation, and the home health aide should know what is ordered for their client. This will likely include a low cholesterol, low fat, and a low sodium diet. Some physicians now prescribe what's called a Mediterranean diet, which is higher in olive oils and lower in meat. Progressive exercise regimen by a physical therapist, meaning that you're starting with slow, easy exercise and gradually progressing up to more intense exercise. They may take medications that regulate their heart rate and blood pressure, and they'll likely have regular blood work to monitor the levels of their medications or the levels of their cardiac enzymes. The patient should really be encouraged to quit smoking. Try to avoid extreme temperatures and help them manage stress. If the heart muscle is damaged by coronary artery disease, a heart attack, or hypertension, it can no longer work as an efficient pump. When the heart cannot pump as effectively, then the blood and fluid starts to back up in the body. If the left side of the heart is damaged, the blood and fluid will back up into the lungs, causing shortness of breath. If the right side of the heart is damaged, the blood and fluid backs up into the body, usually pooling in the feet and lower legs. Think of the heart and circulatory system like traffic on a highway. If too many cars are trying to get to the same place at the same time, then the traffic becomes congested. Imagine how traffic on the freeway slows down when it's reduced to one lane. When vessels narrow or constrict, the same thing happens in the body. If the cars and trucks did not slow down and just kept going at their current speed, what would happen? All kinds of problems. The same thing happens in the body. If the heart, for some reason, is no longer working effectively as a pump, then things will get backed up either in the body or in the lungs. Signs and symptoms of congestive heart failure are fatigue or weakness, a fast heart rate, an irregular heart rate, meaning it's not beating steadily but unsteadily, shortness of breath, dizziness, swelling of the feet or ankles, urinating more, especially at night, and weight gain, more than 2 pounds per day, indicates that it's water weight. Now, how is congestive heart failure treated? There are some medications your patient will take. Medications to slow and strengthen the heartbeat and improve the pumping, and medications to get rid of excess fluid in the body or lungs. Strict fluid intake and output measurements must be taken. What that means is that you must have a measurement of everything your client drinks and everything your client eliminates through either urine or stool. Regular weight monitoring. A lot of times your client will be weighed every day so that the health team can quickly respond if there seems to be an indication that fluid is backing up. And of course, a low sodium diet to control fluid retention. How can the home health aide help? Medications may cause the client to use the bathroom more frequently, and you need to support and predict these increased needs. As I mentioned before, clients often don't like to take these diuretic medications or these medications that eliminate the extra fluid. So make sure you give your client extra bathroom breaks and prepare for it before going anywhere. Help the client follow their special diet. Measure how much they drink and how much they urinate. Weigh them as directed by the doctor, always at the same time of the day. And apply pressure stockings to help with venous return. Use 2 pillows to prop them up in bed to help them breathe better at night. It's common for cardiac medications to cause dizziness as a side effect. If the patient gets up, have them stand at the bedside for a few minutes once they're standing, and then have them sit at the bedside for a few minutes when they change from lying to sitting. Peripheral vascular disease happens when there's poor circulation to the feet, hands, arms, and legs. This usually happens because of narrowing and hardening of the arteries and veins. Some of the risk factors for peripheral vascular disease are smoking, which constricts or narrows the heart vessels, diabetes, a sedentary lifestyle, or when people don't get a lot of exercise, and obesity. Signs and symptoms of peripheral vascular disease are discolored nail beds, swollen hands and feet, poorly healing wounds, and skin ulcers on the feet and legs. How can the home health aide help? Impaired circulation can cause tissues to die, so the client may have less feeling in their hands and feet, making them at risk for injury. Be careful about cutting toenails and fingernails. Watch carefully for pressure ulcers and use pressure-relieving resources. Encourage your client to quit smoking. Keep their legs elevated to improve venous return, and remind the client to take all prescribed medications.